Rebecca Kazin joins us to discuss those dreaded secret skin agers. You know, the tell-all tale sign of your true age, and a few of her easy in-office solutions to help you reclaim that youthful look. So, yes, welcome, Rebecca Kazin. Dr. Kazin, yes, so the hands. I always look at people's hands. Besides their face, you look at their hands. So that's a giveaway.
I know. It's true. We all are so used to protecting our face from the sun, and we've been great with makeup and sunscreen over the years. But if we really want to look at the hands. They tell all.
Because they're supposed to exfoliate this, like, not only the skin on the face, but the hands too, right?
Exactly. And also, we usually put sunscreen on, but we're washing our hands constantly. Plus, the hand washing is very dehydrating. And so a lot of times our hands take a lot of wear and tear.
Oh, my goodness. And the feet. I noticed some people, their feet will kind of give them a...
True. The tops of the feet again, because the sunscreen wears off, and then the bottoms, the skin gets thicker, things like that. But there's this product, Radius, that we've been using for years in the face very successfully that has now gotten FDA approval for use in the hands. Because a lot of times just from normal wear and tear, our hands become very thin and kind of deflated. I always joke that a youthful surface is like the surface of a grape, but an older surface becomes like a raisin. And so if you want to reinflate that to be closer to a grape, but by no means looking puffy.
So that's what we're seeing here, that loose skin.
That loose skin, we just inject a tiny bit of this filler, and it's white so that you can't see it through the skin, and even in darker skin you will not see it. And it works immediately to kind of reinflate that deflated appearance so that you don't see so much of the bony prominences and the veins that can really tell our age.
So now when you call it a filler, what is that exactly like? Does it stick in the body forever, or does it eventually dissolve and you come back like a couple months later, 6 months or so?
So these fillers are the ones that have been used in the face for years. They're basically products that bring in water and build collagen. So they really integrate into the skin. You don't have to worry about them migrating elsewhere. And then they get cleared from the body just as other things that we ingest get cleared by the body.
Okay, so one of the other things that we're concerned about is the neck. The neck can give it away. So what do you suggest for
Right. So same thing with all those years of, you know, being out in the beach in the sun. A lot of times this part of the neck is spared because it's the chin, but this part gets a lot of sun exposure. It becomes red and brown and kind of fine lines. And then this part, and especially in women who kind of will wear a dress with show a little bit of cleavage, sometimes you can see those little lines, and they're really hard to get rid of. So a great treatment option is something called Ulthera. Ulthera is high-intensity focused ultrasound, and it tracks that collagen and tightens the skin, where we didn't really have a good option for this before.
Wow. Okay, so now there's the neck. There's the pictures of the neck.
So so it works.
Doing that chicken thing, that doesn't help anymore?
I know. Yeah, so a lot of times people say, you know, what can I do about my neck? I don't have that sharp jawline anymore. And Ulthera is great for that.
Okay. Now, when we're talking about the neck, and then there's the chest area that you were talking about with the lines, that, you know, Ulthera can help with that as well. So you mentioned going out in the sun, that can do some damage, but what about those who avoid the sun? What about just smiling? You get those laugh lines or frown lines?
It's true. It's true. I mean, a lot of my patients say, you know what, I earned those lines, and I'm going to keep them. But a lot of times patients will like these lines, but don't like these lines, because they'll say, it looked like I smoked and I never did, or they don't like these lines, it looks like I'm frowning when I'm not. And there is an awesome product called Bellatero. It's also a filler, but it's a different class of fillers that's great for these etched-in lines. I call them scratches in the record, which is funny because my kids don't even know what that means.
They're like, what's a record,
What's a record? But it works really well. We've used some topical numbing, a series of small injections, even good for the most needle-phobic patient, and it works immediately.
That's another thing I was going to ask, the needle, because the needle's really, really small.
Really small. And we use topical numbing cream, much stronger than the over-the-counter numbing cream. So I actually have it done to myself, and I'm a big baby, and it's really tolerable.
You do? You look fabulous.
Well, thank you.
You do. You look great. Now, when you talk about, quickly just define the difference between a filler and Botox, because people think they're one and the same, and they're not.
For sure. So Botox is a brand, but it's a neuromodulator. Other brands include Xeomin and Dysport. And what they do is temporarily relax the muscles that cause lines. So the muscles that cause the frown lines, these lines, and also when we smile, these kind of squint lines. Filler does not affect muscle movement at all. It literally is gel-type substance that's injected superficially under the skin, brings in water, and builds collagen.
Okay, so when you're talking about collagen, but is there something you have to remove cellulite or to make it less, so it doesn't appear as much?
Yeah, so I'm sure most people wouldn't be surprised to find that over 90% of women are concerned about cellulite. And
Right,
generally, this happens in women who are at their ideal weight. It's a genetic thing, and a lot of times occurs after puberty from the estrogen. But basically, it's that dimpling in the skin, and it usually is around the rear and on the back.
So you look like a golf ball. You do. You look like a golf ball. You take a look back there. It's like, you know, you're waiting for Tiger to tee up. Okay.
So what's happening is the actual dimples are little strands of fibrous septi that are tethered down, and this new treatment called Selfina actually works to subsize or disconnect those little tethers so that skin is now smooth and you don't see that dimpling, and it's unbelievable.
So
how
I
well
need
it works.
filler for my bottom? Is that what you're trying to say? Because I thought that's how I got the bottom anyways, because there's too much filling back there.
No, so the bottom is not filler. The bottom is releasing these little tethers so that the skin is then smooth. Then we put the filler elsewhere. I know.
That's a lot going on.
It is. That's
Both
why you have
top
to
and
come
bottom.
see me. I'll talk about it all.
Speaking of coming to see you, how do we get in touch with you?
So we have 2 offices now, one in D.C. and now one in Chevy Chase.
Okay.
We are on skinlaser.com, and we have all these amazing treatments.
Amazing treatments. Okay. So I don't look like a golf ball.
You will not look like a golf ball.
Or a cantaloupe. Okay, I got it. Thank you, Dr. Rebecca Kazin, for showing us ways to keep your skin looking young and healthy. And, of course, more with Let's Talk Live coming up.